Well, hello everyone. Dr. Darvish here from Holistic, and it is time to have another live with Dr. Marion. So, in the past, we have been talking quite a bit about breast cancer in the past month, and we now want to focus a little bit more about therapeutics. So, I'm going to bring Dr. Marion on to join me. Hello, Dr. Marion. Are you there yet? You're connecting.
Hi.
There you are. Hello. How are you? Good to see you.
Good to see you. I'm doing well.
Good. It's cold out there. But it's so beautiful out there, too.
Yeah, it is cold out there.
I think we're getting a little reverb, so hopefully this is cleaner.
Yeah, I think it just takes a minute to kind of
balance out.
I think that happened last time, yeah.
So, during the last month, we've spent a lot of time discussing breast cancer and early detection, thermography, which, by the way, is on special till the end of this month at Holistic. And we've talked about cancer as a metabolic disease. We've talked about foods for cancer. So if you've missed any of those lives, you're more than welcome to go back to some of the lives we've had, and they're recorded either on Instagram or Holistic Medicine Facebook, and review some of those. And hopefully there is some useful information coming out of those lives. So today we're talking more about exploring the adjunctive therapies for cancer. And I think this is a really important verbiage, Dr. Marion, that we have to kind of explain, is this whole concept of what does adjunctive cancer therapies mean? What does supportive cancer therapies mean? Because the FDA really sees cancer treatments and cancer therapies to be more of the conventional, like the chemotherapy and radiation, and everything else, including nutrition, some of the things we're going to be talking about today, like Mistletoe and vitamin C and Poly Plus, and a whole bunch of different things we're going to be talking about today, are regarded as adjunctive or supportive cancer therapies. And so that's the focus, because we know that from the studies and from clinical experience here at Holistic, that every patient that gets supportive cancer therapies involving naturopathic and integrative therapies in conjunction with their chemo or radiation, that the quality of life is significantly better, that longevity rates significantly improve, and just the sense of well-being is maintained, and there is better chance of going into remission when you add in these therapeutics. So we use these therapies not to only help the immune system, help the well-being of the body, reduce inflammation, really looking at treating the body versus the cancer. We're also looking to optimize the benefits of chemo and radiation, which, as many who have experienced those therapies, they have a lot of different side effects like nausea, low white blood cells, anemia, vomiting, fatigue. And so when we add in these cancer therapies that are more supportive, then we see more of an optimization of the white blood cells, less anemia, less nausea, basically more tolerance for the adjunct or for the chemo and the radiation therapies. So food, we've discussed a lot, is obviously a big factor as part of the whole adjunctive therapy. Hello, Shaheen. Nice to meet you. Nice to have you join us. So food is a big deal, but we've spent a lot of time talking about that, right, Doc?
Mm-hmm.
But let's talk a little bit about those specialized therapies that we do here, which are so vital in shifting metabolism, cancer metabolism, the immune response, inflammation, and so forth. So why don't you start us off, Doc?
Sure. Well, first off, I just want to say this is a really important topic for me, and pretty near and dear to my heart, because when I was in chemical engineering and eventually veering off into environmental engineering, I actually started taking immunology coursework at the School of Medicine, at UW School of Medicine, and I became so enamored with the human immune system, and it was so freaking cool and effective and incredibly engineered beyond anything humans could ever engineer ourselves, right? So even the most complicated fuel processing plant does not even start to broach the complexity and the really the sort of miraculous engineering of the human immune system. So that is really what drove me away from engineering and towards medicine. And at the time I was really interested in autoimmune diseases, but there's a lot of interesting polarity between the immunological system's approach to autoimmunity versus cancer. And so basically immunology is really a passionate topic of mine. So I'm excited for this topic because the adjunctive therapies that we're going to talk about today have really fascinating mechanisms of action. And so you might think, well, why haven't I heard about these things if they're so effective and so supportive to cancer treatments? And the answer is that many of them are not backed by pharmaceutical research funding. And so you're not going to hear about a lot of the therapies because they're not as patentable and they're not as lucrative financially as far as pharmaceuticals go, because chemotherapy is a multi-billion-dollar industry. So we're going to be talking about quite a bit today. Why don't we start off with, how about mistletoe?
Mistletoe. So one of my favorites, Doc.
Yeah.
And just to continue with your story, my story, I should share my story if I haven't yet on some of these Insta Lives, is that basically I've dealt with some kind of a cancer from the moment I stepped into Bastyr in terms of my family. Not myself, well, my family, even myself, actually. I did have something called ameloblastoma, which is a tumor that grew in my jaw that can act cancerous as well as be benign, and it can go either way, and it can recur and affect or metastasize to other parts of the body, including the brain. And so I dealt with that in the early 2004, just after we had opened up Holistique, and just after about a year after I had my first or third baby, actually. She was only about a year and a half or so when I was dealing with this. And so at that time, there was not as much information available for all of these therapies that we have access to now, but enough that I was able to turn that around. And I'm still, 20 years free of any kind of tumors growing anywhere, thank goodness. Knock on my head. But then my mother herself, I've had, mother-in-law, father-in-law, sister-in-law, cousins, all go through this cancer deal. And my mother is probably one of the most powerful shifts that I've seen in terms of my own family, because she had the most aggressive cancer, very similar to pancreatic cancer, ovarian, uterine, serous carcinoma, and they had given her less than a year to live. And she refused chemotherapy and radiation, and instead decided to do some of these therapies. And to this day, we're still doing some of the mistletoe therapy. We're still doing, we did IV vitamin C. We have been doing IV vitamin C, and the ozone therapies, because she's in Canada, I don't have as much access to helping her with that right now, but she was doing all of that, hyperbaric oxygen therapy, emotional release work, and many of the other treatments that we're going to be talking about today. She has done them, and now it's been 8 years, and she's still, knock on wood, still here with us today. And her brain and mentality is as strong as ever, and her will to survive and thrive is stronger than ever. And so it's a story of empowerment, of not letting cancer beat you, because we have the capacity to beat cancer, and we really need to look at the whole person and not just focusing on the tumor. We need to look at all the positive things, the positive aspects of our well-being that need to be potentialized and optimized in order to fight off any leftover cancer cells. So mistletoe, as you said, is a fabulous one to start off with, and it is one that has been studied for many years, decades in Europe. And I just saw actually that they started a study on this at Johns Hopkins University this year. So that's even more exciting because maybe we'll have even more access to mistletoe. But why don't you tell us a little bit about mistletoe, Doc?
Yeah, hopefully so. So white-berried European mistletoe, by the Latin name of Viscum album, has been used successfully to treat cancer patients since 1917. And actually, they've been using it to treat spleen conditions as far back as 460 BC. So it's really has a long history in medicine. And there are over 7,000 studies published to date regarding mistletoe. 80 to 85% of German and Swiss and 60 to 70% of the rest of Europe's medical doctors integrate the use of mistletoe during chemotherapy and radiation. So it's really commonly used in Europe and not so much in the United States. However, we use it frequently in our office. It is known to reduce adverse effects of chemotherapy, such as anemia, neutropenia, which is a low particular white blood cell count, thrombocytopenia, so low platelets, hepatic toxicity, so liver issues, and nausea and vomiting. And it's also used for palliative, so to improve the quality of life of cancer patients, is helpful in treating pain, reducing ascites, so swelling in the abdomen, and pleural effusion as well, so swelling around the lungs. So the mistletoe mechanism of action is really quite interesting. The mistletoe lectins are directly cytotoxic, meaning cellularly toxic to the cancer cell membranes. It's also anti-angiogenic by lowering something called VEGF, which drives angiogenesis, so the growth of new blood vessels, which a lot of tumors will do in order to feed themselves. They will start to cause the body to create new blood vessels in that area. So mistletoe inhibits that process. It also stabilizes and repairs the DNA of cells. It inhibits the cancer spread as well. It's anti-inflammatory. And then it does something called immunomodulation. And we use the word immunomodulation when we're discussing something that is not necessarily immunostimulating and not necessarily immunosuppressing, but it works with the immune system in a homeostatic way. So in order to bring balance back to the immune system. And so specifically, it stimulates macrophages, T cells, NK cells, which are natural killer cells, which are really important in fighting cancer in the body, dendritic cells, and cytokines. So it's going to help to modulate all of those. Again, not necessarily stimulate or suppress, but balance. It also acts as a fever-inducing therapy. So in naturopathic medicine, we often talk about the benefits of fever to the immune system. And so mistletoe can stimulate a sort of flu-like response. And that's what we want. We want the immune system to get activated towards the cancer and fight it. It enhances, again, as I mentioned, overall quality of life by reducing side effects. And it can be administered in a number of different ways. So sometimes we'll send patients home and they'll do little injections right underneath the skin. Other times we have patients come in and we do it intravenously as an IV. And other times they will use it directly into the tumor. And as well into abdominal ascites, so that abdominal swelling and the lung swelling as well, pleural effusion. So really pretty fascinating mechanism of action, but it has been used for a very, very long time. So there's a lot of history with it.
It's a really awesome therapy. One of my favorite therapies. Thank you for that. There are 3 forms of mistletoe, and so the 3 forms are really important as to the type of cancer that you may have or may be trying to prevent, as well as the whole condition of the patient. So there is a mistletoe A, which is also comes from fir tree. There is mistletoe P that comes from the pine tree, and then mistletoe M that comes from the apple tree. And so for breast cancer, we typically use mistletoe M in conjunction with whatever other therapies you're doing. But if you're in stage 4 and really, really weakened, then we may start with one of the more gentler forms of mistletoe, such as the A form. But like you said, it's a very, very powerful treatment in reducing directly tumor size and tumor cells because it has direct effect on the tumors, but it also helps the body, right? It also gives the sense of well-being, energy, mental well-being, mental clarity, just the feel good, as long as we're monitoring it and not overstimulating your immune system where you're not getting too much of those flu-like symptoms. So it is something that we have to prescribe by prescription. It is not something that you can just pick up over the counter. It is by prescription that we prescribe, and then you receive that from the pharmacy, and then bring it in, and we dispense it in form of intravenous therapy, or teach you how to do it subcutaneously, depending on what is going on with you. So what's next on the list, Doc? Photodynamic therapy, should we go there?
Yay, yeah. So photodynamic therapy is really exciting. Basically, this is a fancy word for laser. More or less, this is laser therapy, but there are many different types of lasers. But light in general has been used as a therapy for more than 3,000 years. So ancient Egyptian, Indian, and Chinese civilizations used light to treat various diseases, including psoriasis, rickets, vitiligo, and skin cancer. And at the end of the 19th century in Denmark, a physician by the name of Niels Finsen found that red light exposure prevents the formation and discharge of smallpox pustules and can be used to treat the disease. So light therapy has also been used for a long history in medicine. Finsen also used ultraviolet light from the sun to treat cutaneous tuberculosis and received the Nobel Prize in 1903 for that work. So photodynamic therapy requires 3 elements: light, a photosensitizer, and oxygen. And so a photosensitizer, a photosensitive molecule that localizes to a target and or tissue. So photosensitivity basically means the amount to which an object reacts upon receiving photons. So the amount to which a chemical substance changes in any way by way of being exposed to light, basically. So when the photosensitizer is exposed to a specific wavelength of light, which is the laser that we're using, it becomes activated from a ground to an excited state, basically from its normal resting sort of energy and then up to an excited state where it's agitated, basically. As it returns to the ground state, and this is getting a little bit back into some probably college physics, it releases energy, which is transferred to oxygen to create reactive oxygen species, such as single oxygen and free radicals. And so those reactive oxygen species mediate cellular toxicity. And so these reactions occur in the immediate locale of wherever the light absorbing photosensitizer is. So if it's intravenously, it's going to be in the bloodstream. If it's locally to a tumor, it's going to be in that environment. So the biological responses of the photosensitizer are activated only in the particular areas of the tissue that are being exposed to light. So it's also a very directed treatment in that way. There are type 1 and type 2 reactions in photodynamic therapy. So following the absorption of the light, the sensitizer is transformed again from its ground state to an excited state. And the activated sensitizer can undergo 2 kinds of reactions. And both of these reactions are important when we're discussing the effects on cancer. So first, it can react directly either with the substrate, such as a cell membrane or a cancer cell membrane, or a molecule transferring a hydrogen atom to form radicals. So the radicals interact with oxygen to produce oxygenated species. Again, you've probably heard of reactive oxygen species. Alternatively, the activated sensitizer that you're using can transfer its energy directly to oxygen to form singlet oxygen, so which is also a highly reactive oxygen species. So both of these effects are highly anti-cancerous, and they're also used in a number of other applications. We often will use it for viruses, both acute and chronic. And interestingly, a lot of those same viruses are also involved with certain types of cancers. So we know that lymphomas are often associated with Epstein-Barr virus and cytomegalovirus, both of which can become chronic or reactivated. And so often we will be using the treatment both to reduce that viral activity, but also as a preventative approach to make sure that that's not something that's going to progress towards something like a lymphoma. So it's a really pretty fascinating therapy. We have all different colored lasers. We have a blue, we have a green, we have ultraviolet, we have yellow, and we have infrared. I think we have red. I'm probably missing that one.
Yes, and ultraviolet.
So it's really exciting actually to see the effects of those different wavelengths. So for example, a certain type of tumor or a certain type of skin condition might benefit from one or the other of those wavelengths, or might benefit from all of them. And then the particular photosensitizers that we use are specific to those colors. For example, for the blue laser, we might use riboflavin, which is vitamin B2. We often will use EGCG or turmeric, or curcumin, sorry, which is part of turmeric, both of which are also helpful in photosensitizing. So really pretty fascinating applications of the more or less laser therapy, fancy name photodynamic therapy, that we're really excited about.
Yeah, that's great. Thank you so much for going through all that mechanisms of laser, because at the end of the day, what I've seen clinically is tumors shrink, and I've seen infections completely dissolve away because of the light therapy and the frequency and the photosensitizing agents, and the immune system improving, energy improving. So your individual energy well-being also improves. And again, back to the quality of life with a lot of these therapies that we're discussing, right? So laser is very, very simple, because we just, if we're doing an IV therapy of any sort, we just switch the system over to the laser, connect that to your catheter, and you just sit there for about 20 minutes and let the light radiate your blood as your blood's circulating through your system and doing what it needs to do to potentiate immune cells and hopefully reduce cancer cells as well. So that's photodynamic therapy. There's a lot of research coming out on that. The machine that we have is out of Germany. It's the highest end machine that we have here that provides, like you said, all of those colors. And, we also use it for things like Alzheimer's and skin health and anti-aging effects. So it's not chronic infections,
Lyme disease.
Yeah, so it's not just for cancer, it's support. It's really for a whole person well-being, anti-aging, optimization in every form. So it's
I would say it's probably the funnest new sort of progressive treatment that we've had in a while.
Yeah.
We always get new things on board, but we're basically inserting a fiber optic into a vein and irradiating the blood as it passes by, which is really just fascinating and pretty non-invasive as far as treatments go, because it's just light. We're not introducing a foreign substance. We're not introducing, a vitamin or mineral or really anything. It's just light. So it's pretty cool.
But it's also amazing how people actually feel the effects of it, right? Yeah. Sometimes people say, oh my gosh, my brain feels so much more clear getting this therapy, or I'm sleeping better because of this therapy. So it's really an up and coming therapy that is being more and more researched throughout the world for different kind of conditions, anything from cancers to autoimmune diseases to neurological diseases, anti-aging, so forth. So let's talk a little bit about Celestinium. Yeah. Celestinium is probably something I've known about for at least 10 plus years, maybe even longer. The company that has this and makes this is here locally in Bellevue. So just neighbors with us. We have a really awesome relationship with them. And it is basically a benzaldehyde. And that means that basically it's a substance that impairs blood sugar, or I should say sugar metabolism of the cancer. So in other words, the way cancer uses sugar to make energy and reproduce itself and feed itself, it blocks that system. And There's a study of about 128 breast cancer patients that this was initiated in, and they were all stage 4 cancers. What stage 4 means is that the breast tumor has expanded to other parts of the body. It can be in the liver, in the lungs, the brain, and other parts of the system. So they looked at 128 cancer patients, breast cancer patients specifically. Actually, I think the study was looking at over 600 cancer patients, but 128 of them were breast cancer. And they gave them IV therapy of this Celestinium for about 2 to 4 weeks. It's about 15 to 24 sessions, depending on what type of cancer it is. And then they switched them over to oral version. And 70% of the 128 cancer patients were either stabilized with their cancer or they had partial or complete remission by the end of the 2-year plan. And this is significant, guys. 70% compared to 16% of what we are finding with chemo and radiation therapy. So only about 16% of stage 4 breast cancer patients survive 2 years based on just chemo and radiation. But you add in the Celestinium and you're up to 70% survival rate. It just puts shivers down my back. It's so powerful. It's so mind-boggling to know that a natural substance is like Celestinium, which is a plant derivative, can transform the cancer metabolism and the body as well, in fighting off these cancers and stage 4 cancers, which are really difficult to fight. And the reason stage 4 cancers are difficult is because you get different levels of cancer growth, different stages throughout the body. It's like having a car with the wheels going at different rates at different times, and that car is stuck. It just doesn't know whether to go back or front, or maybe doing something funny, right? When you have the 4 wheels going in different directions, different times. And so that's what stage 4 cancer does, is it goes at different directions, different times throughout the body. And getting that under control with just chemotherapy is super difficult, because chemo focuses only on one wheel. It doesn't focus on all the 4 wheels going at different directions. It's only focusing on one wheel at one rate. And so Celestinium, amongst the other therapies that we've discussed so far, work at really getting the immune system to work at the 4 rates of the wheels that going at different rates, bringing kind of the immune response the way it needs to be addressed to different systems. And so that's one of the reasons why Celestinium is so powerful in shutting down the cancer explosion basically in the body. It shuts it down, it gets it under control, and in some cases it can go into remission, in other cases partial or at least stabilized, at least in 70%. So one of the ways we monitor Celestinium in the body is by looking at the nagalase enzyme, the nagalase levels. Nagalase is an enzyme that's released when cancer is using its sugar, and the activity is high with sugar metabolism. And so with cancer, we see nagalase levels go up. We also see nagalase levels go up in viruses as well, because viruses tend to use a very similar kind of a metabolic process to grow and expand themselves throughout the body. So we can follow nagalase, and we'll often see that when we incorporate some of these holistic integrative therapies, that the nagalase numbers start dropping in the blood. And that is a sign that the cancer cells are kind of coming under control, that they're not as actively utilizing sugar, they're not being fed as much as they were initially. And so with Celestinium, we see an 83% improvement in that nagalase enzyme in the cancer patients, which is, again, really, really incredible. So Dr. Marian, I know we're almost out of time. We only have like a couple of minutes left. Mm-hmm. What would you like to focus on?
So the couple of things we just didn't talk about very much, but you can probably find some info on the previous Instagram lives, are ozone and high-dose vitamin C. And just briefly, ozone is 3 atoms in 1 molecule attached together. And so that intravenously and by other methods creates a hyperoxygenated environment. And remember that cancer cells are anaerobic, meaning that they function without oxygen. And so a hyperoxygenated environment is directly toxic to those cancer cells. We actually will also use hyperbaric oxygen therapy in this method, using this mechanism as well, which is where we place individuals into a compartment and then increase the pressure and therefore increase the oxygenation to tissues. So there's a whole, we could probably do a whole talk on just ozone, which we probably will. And then vitamin C, everybody knows, right? It's immune stimulating, but actually at high doses, it's also oxidative. So cancer cells lack a particular enzyme known as catalase. And catalase is the enzyme that allows our healthy cells to tolerate oxidative environments. So when we give individuals 50 grams and above of vitamin C intravenously over the course of several hours, that creates an environment that is toxic to the cells that lack catalase, which are cancer cells. And so we might use anywhere from, again, 50, 60, sometimes 80, 90, 100, depending on the individual. But again, both of those topics are pretty large. We may dedicate a whole talk to them.
Yep. And then there's the peptides, which is another favorite of mine. And peptides, just for some of you that may have heard of them but don't know what they are, they're actually chains of amino acids, and they're involved in signaling. So the thymus gland, for instance, is involved in signaling your immune response against cancer cells, against viruses. And as we age, or when there is toxins that are coming at our cells, the thymus gland, for instance, is not producing those signaling agents as much as it was before. And so the body becomes an open field for cancer to grow. Once we introduce those signals back into the body, those peptides back into the body, then there is some fighting mechanism, some signals saying, hey, immune system, wake up and start fighting. And so we see some of these peptides being really important in conjunction with chemo and radiation, in autoimmune diseases, in anti-aging, in accentuating the growth hormone process in the body, balancing the white blood cells, the red blood cells. And
there's even a peptide that makes you more tan.
Yes, it does. And that is actually really important for the immune system as well, for some of these conditions. So peptides, for cancer, there is some peptides that have direct cytotoxic capacity. In other words, they directly kill cancer cells, but they also have, or we have peptides that increase the white blood cells. So when you are in chemo or in radiation and you are suffering from low white blood cells, just stimulating that signal, giving your body that peptide that it needs to activate the immune system to build up the white blood cells is maybe all you need. And we've seen the benefits of those peptides with many of these situations. So
real quickly, I just want to mention real quickly, the reason that chemotherapy affects the immune system is that the action of chemotherapy is largely to affect rapidly dividing cells. And so cancer rapidly dividing is affected by chemotherapy agents, but the immune system is also rapidly dividing. And that's why you'll commonly see some autoimmune diseases actually treated with certain types of chemotherapy. So we are not counteracting the effects of chemotherapy by supporting the immune system. We're actually rebalancing the body to minimize the negative effects of chemotherapy because the immune system is impacted, but we actually need that immune system because we need those natural killer cells and the rest of the mechanisms that are actually going to be supportive as anti-cancer attacks from the immune system.
Yeah.
So this is an aside note.
No, that's great. Thank you for mentioning that. And there's so much more to talk about. This is a huge subject, and it is something that is completely personalized, individualized to our patients with their specific cancer. So just because 2 patients may come in with the same type of cancer, we don't treat both of them the same way. It's completely individualized and personalized. And one thing that we really haven't focused in on this segment in terms of integrative therapies is the emotional and the spiritual aspect of our well-being, which is another big component of how cancer has the capacity to survive when we're in fear mode and when we're in shame or guilt mode. And how do we pull ourselves out of those situations? How do we get rid of the guilt, the shame, and the fear so that our immune system is more available to fight the cancer cells versus trying to constantly deal with the emotional, what I call drama and trauma, right?
Yeah, absolutely.
So that's a whole new that's a whole other segment again. With so much to talk about, so much to learn. And again, I just want to remind everybody that these lives are just for informational purposes. And please make sure that you understand that these therapeutics are supportive therapies. They're not to replace chemo or radiation. And I want to be clear with that, because as naturopathic physicians in the state of Washington, we have to have you be under the care of an oncologist, as we're working with you on a whole body, whole being level. So if you have any questions, any concerns, or any conditions that you need to have addressed, personalized, and evaluated and treated, please do seek us out at holistichealth.com. And we'll be more than happy to have an online telehealth conversation with you, or in person. We're available on telehealth, which is, we've been available on telehealth for many years, but I guess it just went up a notch since COVID. So look forward to talking with you next time. Next week, we are discussing breast implants and breast implant illness, and actually have at least one patient, if another one may join us, to share with us her experiences going through breast implants and breast implant illness. So that will be next Thursday, 12:15 Pacific Standard Time. And thank you again, Dr. Marian. Thank you to all of you for joining us. It's been a pleasure, and we look forward to seeing you next time. Love to you all. Bye-bye.
Bye.